A week ago, the coronavirus case rates in Philadelphia were rising, and we expected them to continue. But instead, since then, they fell. And I don't know if that's a long-term trend or something temporary, but any decrease is good news. So here are the numbers. Since this time yesterday, we've identified 106 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 30,771 since the beginning of the epidemic. Now, for the past week that ended Saturday, July 29th, we averaged 123 cases per day. That's down from 166 cases per day the week before, and 141 cases per day the week before that. Now, our new cases that we got today are still predominantly younger people. 35% were under the age of 30, and 52% were under the age of 40. We also track the percent of people who are tested that test positive. And for the last week that ended last Saturday, we averaged at 4.7% that were positive. And that's the lowest weekly percent positivity yet that we've seen yet. We've been between 5% and 6% since the middle of June. So that's another good sign. Since this time last week, we've identified 3 new deaths from the coronavirus infection, bringing us to a total of 1,695 since the beginning of the epidemic, of which 860 or 51% were in nursing home residents. Now, in the past week, we're averaging about 7 deaths per week, or about 1 per day. To put that in perspective, at the peak of the epidemic in mid-April, we were averaging nearly 250 cases per week. We're down about 97% as far as the number of deaths we're receiving per week. In our nursing homes now, we're getting about 2 cases per day citywide. That's a very low number. We want to have it be 0 if we could. We're watching that very closely. And in the city's jail, a few positives that came up in the past week or so. We had 1 inmate who went to the hospital for a different reason, not related to COVID, and was screened there, was tested positive. In the wake of that, the jail screened 64 other inmates in the unit, of which 4 others tested positive. None of those 4 others had symptoms, or other ones are still fine. As far as our testing citywide, we are seeing improvements in the turnaround time for 1 major laboratory that is supplying testing for the city. That's the Lab Corporation. They were having a turnaround time average around 7 days. Now they're around about 2 days, much better. Still, we're having long delays for another big laboratory, Quest, and some delays that are too long for some other smaller laboratories. A little update on where we are with contact tracing. We're making progress since what I reported last week. So for the period from Sunday of last week through Friday of last week, which we haven't quite closed out, but we're close to it, we attempted to reach 611 cases for whom we had phone numbers. Of those, we were able to complete the interview on 64%. That's up from 55% the week earlier. We had 3% who refused. That's down from 6% the week earlier. And we have not reached yet 32%. That's down from 38% the week earlier. Of those cases that we interviewed, about a third reported no contacts, either that they didn't have them or they couldn't name them. And of those who reported contacts, they averaged 2.8 contacts per case. And of those contacts, we've now reached and interviewed 70%. So that's what's happening in Philadelphia. Now, outside the city, it's important. Across the Philadelphia region, we are seeing case counts falling in the surrounding counties in the last few days. As with the city, it's too early to say if this is a trend, but that's certainly a good sign. And in the U.S. as a whole, the epidemic appears to be declining now. Daily cases are now falling in the U.S. as a whole, as well as many southern and western states. So in summary, case counts are now falling here in the city of Philadelphia, in the region, and in the U.S. as a whole. Now, they're not falling by much, and this could be temporary, and the case counts are still high. Still, though, the news is better than we were a week ago. And the reason for that fall is really unclear at this point. I can only say that maybe people are finally coming around to accept the idea that they need to wear masks. And mask use has gotten high enough that it's really making a difference. I hope that's the case. Now, let me talk about mask use for a minute. If the case counts fall, I want to remind everybody that's not the time to put away the masks. We need the masks now more than ever. If there's one thing you can do to help fight this epidemic, it's commit to wearing a mask whenever you're around others. It's especially important as we approach the reopening of colleges and universities and some schools in the city. You know, when you wear a mask, it's a sign of respect for the people around you. You don't want to pass the infection on to them if you have it and you don't know it. Now, we do track mask use in Philadelphia. We have a graph on our website. That's based upon observations we're doing on people in indoor SEPTA stations and exiting retail stores. When we completed the data from last week, overall, it was 71% of people observed were wearing a mask. There's an overall increasing trend, but we want to get up to 90%. We have a goal of 90%. So most people are doing the right thing, but we need to get more to use masks regularly. Finally, let me just remind people about the risks to vulnerable populations. Even though we have a slight decrease in case counts, there's far more virus circulating in Philadelphia than is safe. Remind you, if you're over the age of 65, or if you have chronic medical conditions, you are at risk. Stay at home and avoid contact, even with relatives and caregivers who might themselves be out and about because they may be exposed and you don't want to get the virus from them. So if you're staying at home, your relatives and your caregivers who are with you should be wearing a mask, and you should be wearing a mask when you're around them. More information is on our website, www.phila.gov/COVID. Thanks. Yeah, the connection wasn't good. I think I understood your question is, can we redirect the testing to hospital laboratories so we get a quicker turnaround? We are trying to redirect testing to laboratories that have a quicker turnaround. I can tell you the hospital labs are telling us now that they do not have the capacity to do additional tests because they're having difficulty getting the reagents, that is to say the chemicals that they use, to run these tests. So there's a limit there, but we are trying to redirect to some non-hospital laboratories that are in the local area. They can do the test more quickly. It's a more complicated process than you might think, but we hope to do that so that even if we can't solve the problem today, over the longer term, we're not so dependent on these national labs that can have have bottlenecks and long turnarounds.
Thank you. I appreciate that, Brian. Yep. This question is for Dr. Farley. Dr. Farley, Dr. Fauci, I think it was Monday, talked about the aerosolization of the virus now, and recognizing that the virus, one, we should probably be wearing goggles, but two, that it's definitely not a good idea being in small spaces. With what we're talking about for pre-K, is there any guidance you're planning on giving pre-K sites or centers to open a certain way to deal with what's in the air, not so much the hands and the face and mask, but is there an air filtration that they need to be aware of or thought around that?
Yeah, thanks for the question. So we still think that the predominant mode for transmission is to people in direct contact with each other through large droplets. However, there has been this question for a while now about the degree to which these small aerosols that they could float in the air might be able to spread the infection from one person to another. And then that gets to the question of how important ventilation is to reducing the risk of spread. We haven't talked about that much in the past, and in view of at least the concern out there and the possibility that is one mode, even if not the predominant mode of transmission, we're probably going to be making some recommendations soon that just clarify what steps to take to improve the ventilation to lower that risk. I don't think that those steps are going to be impossible for people running buildings, whether it's a daycare center or others, to follow. But we want to give some clarity for people of what they can do to reduce that at least a theoretical risk or possibly a real risk.
The University of Kentucky, and I'm directing this to Dr. Farley, the University of Kentucky is currently in the process of testing 30,000 of its college students in preparation for them to go back to school this fall as a means of having a baseline for possible transmission at the particular university. Has there been any talk about doing that with any of the local colleges here in Philadelphia? Because in 2 weeks, Temple opens and some of the other schools open, and you have parents who are concerned about whether or not their kids are going to be able to do an entire year in their dorm, or if they're going to have to come back home and go to online learning because there's been an outbreak.
Right. So we have been consulting with all of the colleges and universities in Philadelphia about their safety plans. In that, we have not recommended that they require screening of everybody to come back on campus. That may sound like a good idea that, okay, then you start out with nobody infected and then you'll never have an infection. The problem is the virus moves very quickly, and the campus people in the campus interact with people in the community very readily. And so even if everyone's negative today, tomorrow a number of people may be positive. So more important than baseline testing is really being vigilant about masking and using following all the other safety precautions to prevent the spread from one to another. that's what we focused on. And we do think, based on our conversations with the colleges and universities in Philadelphia, that that their plans are strong. Not to say that there won't be a spread on campus, there probably will be, but we think that they can minimize that.
You mentioned that cases are decreasing, but you're not sure where the long-term trend is heading. I just want to clarify, would you actually call this a decreasing cases rather than a potential plateauing of cases?
I would say it's a decrease. The average last week was, I forget the number, I said 123. That's compared to 166 the week before and 140 something the week before that. So that is a very real decrease. I don't know if that's going to be a continued decrease or if we'll see it rise again this following week.
Hi there. I don't know if this is for Dr. Farley, the mayor, Brian, but now that, restaurant workers live off of tips, and now with the extra $600 in the federal stimulus money ending, is there any thought maybe to pushing back the 10 p.m. curfew for restaurants so that some of those workers would be able to maybe make more tips during the time so that they can sustain life and live?
Doctor?
We haven't thought about that. We can talk about it and see if it makes sense.
Was there a reason? I just don't know. Is there a reason for the 10 o'clock, or in general, was there like a study that was showing that 10 o'clock for some reason would make a difference?
I don't believe that's a limit that the health department put on this. I'd have to understand more about the rules, but Brian may know.
Yeah. So, and Kristen, if you remember that, all the restaurants are serving outdoors, and in many of these corridors, they have people who are living on those corridors. And so we are trying to balance the needs of residents with the needs of the businesses and the workers. But I think your point is well taken, and certainly one that we'll explore and see if we can address.
Hi, my question is for Dr. Farley. I was wondering, with the case counts decreasing and percent positive rate decreasing, does that make you optimistic for the possibility of having indoor dining in September, or Eagles fans in the stadium in the fall, or is it too soon to tell?
Since a week ago I called this wrong, I'm going to be careful not to call the future at this point. It's really hard to say where the virus is going to go. I'm certainly pleased to see the numbers go down, but I can't say whether they're going to continue to go down. And I certainly can't say where we'll be on September 1st.
Okay, thanks so much. That's all I had.
Thank you, Kennedy. And Nina Feldman of WHYY.
I'm sorry, Mike, can I go back and just amend that answer I gave to Nina? Just to clarify, if somebody's in quarantine because they had a known exposure, then they need to stay away from people and not go out while they're waiting for the test results.
Yes, Dr. Farley, the statement you just made, if there's a couple and one of them is quarantined, self-quarantine, the person that's not self-quarantined in that same apartment, do you recommend they go out? Do you recommend, how does that work when there are people that work in direct contact with each other, and one definitely tested positive?
Well, if someone's in quarantine, if at all possible, we want them to stay away from their household members too. So stay in separate part of the house, separate room, separate bathroom. If they are constantly in contact with that other person needs to be careful. I would recommend they not be going out and around and exposing other folks.